Hello and welcome to the Headache Doctor podcast. Where on this podcast, it's our mission to educate and empower everyone with headaches and migraine so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to be talking about hormones and their impacts on headaches and migraines, hormonal headaches, everything you should know that surrounds this topic. And joining us today, so I'm Dr. Taves, your host, and we have Dr. Thomas joining us as our expert headache specialist. Thanks for joining us.
Yeah, pleasure to be here again. This was a fun one to research. And I do want to say right off the bat, these are very big issues. We're going to be talking about puberty, we're going to be talking about menopause, pregnancy. All of these could probably be their own podcast in and of themselves. So we're really just going to look at all of these different events and these hormones from a standpoint of headaches. I'll go through briefly just what everything is, just to make sure everyone's on the same page. But I do, if this feels surface level, I just want to tell people this definitely is a big topic we're covering today.
Yeah, I think maybe we'll call it foundational,
Oh, yeah.
meaning I think we're going to go over a lot of insights that are key for people to understand, whether it's the basics of how their body functions and interacts with hormones, to why the headache would change when hormones fluctuate, things like that. So, even though it may not be as in depth as some, I think it'll probably still feel like a good amount of information for most of our listeners.
Yeah. And we do see this as a very common problem. Our caseload does tend to be primarily female. We do see men as well, but I would say the majority of our patients are female. And I'm hard pressed to find one that doesn't have some sort of a increased headache issue around their period. So jumping right in, I before we go any further, I just want to give people a quick education on what hormones are. So, hormones are just chemical messengers found throughout the body. They're released from different organs, the brain being one, obviously the ovaries and the pituitary gland being others for the menstrual cycle specifically. But essentially, they're just chemical messengers. So, if you hear hormones throughout this and you're like, what even is a hormone? That's all it is, just a chemical with a message for something to happen. So, my first thing I wanted to cover is go through just the overall normal menstrual cycle. So, outside of menopause, outside of pregnancy, no puberty, I just wanted to go through very briefly what happens during a normal menstrual cycle. So, the goal of a menstrual cycle is to prepare your body for pregnancy. During that cycle, your uterine lining is going to thicken. The body is going to release an egg, and then the body waits. If the egg happens to be fertilized, then that egg will implant and a pregnancy will begin. If that egg is not fertilized, the body sheds the uterine lining and it starts all over again. Now, this cycle is a little bit variable depending person to person. 21 to 35 days is kind of considered the norm. The average for most women is about 28 days. So, um, typically, you're going to have a number of stages. So, your first stage is the menses stage. This is what everyone thinks of as the period. So, estrogen and progesterone, just right before this stage, they're going to drop sharply. And we'll talk about why in a second. But they're going to drop, and that's going to trigger a period. The uterine lining is shed and bleeding is normal for about 3 to 7 days. So that's your typical kind of when people think of a period, that's what it is. Now, during this, it actually is also the start of your follicular phase, which lasts from the start of your period until the day that you ovulate. Estrogen levels actually start rising. So the drop is before the period, the drop triggers the period, and then estrogen actually starts going up again, as does follicle, there we go, stimulating hormone, which triggers an ovum or egg to be growing within the ovary. Now, around day 14, you get a hormone called luteinizing hormone that's released, and it triggers the ovary to release that egg. So the follicular phase ends, the egg is released, and then the egg travels down the fallopian tube for the luteal phase, which is ovulation until your period. And your progesterone levels rise to prepare for pregnancy. So essentially, your body thinks, we're about to start a pregnancy. It those levels rise and then it waits. Now, if that egg is not fertilized, which for most women it's not fertilized every month, that would obviously not work. Then you have a really sharp drop in the progesterone and the estrogen, and then it triggers your period and it starts all over. So again, on average, about 28 days, 21 to 35, depending on the woman. And it's usually the drop is where we see the trouble with headaches. So we're going to see a common theme throughout this episode that hormone fluctuation, especially estrogen, tends to cause headaches. And we'll talk about all the nuances of that later. But for the period, typically we see the most trouble about 2 days before and 3 days after your period starts, is when our people will come in complaining of headaches. So even if they've been pretty good throughout the month, that maybe they get one headache or two headaches a month around there, maybe their headaches are present throughout the rest of the month, but they have suddenly a lot of days in a row of headache, or their headaches are more severe. And that tends again to be from that drop from an estrogen.
Yeah, absolutely. And this, I think this is an important topic. And thanks for just going through, like, kind of laying that foundation of the cycle. But this is an important topic because we oftentimes find that when there's this strong hormonal component or the trigger itself being hormones. So let's say someone comes to us and they have headaches throughout the month, but they always have a consistent, like really debilitating, severe type headache in that window, in that 5 day window or so. What we find is they'll progress and see a reduction in frequency and intensity, but that window is going to be a stubborn headache, and so we need to figure out and understand from a hormonal perspective, like how do we understand that because it has such a big impact on their threshold with those estrogen progesterone changes that they're experiencing. So
Yeah.
that's great.
Yeah, we tend to see is again that drop in estrogen essentially just lowers your threshold, so it makes you just a lot more likely to be. So even if you've got some neck tension that isn't causing you pain or isn't causing any problems the rest of the month, that drop in estrogen tends to suddenly make your body much, much, much more sensitive to pain, which then again, yeah, can trigger a headache. So yeah, super common, and it's something that you know, it is easy to blame the hormones for, but the hormones aren't the direct cause of the headache. It's just the hormones dropping makes you much more likely to have a headache. So that is just general menstrual cycle, and that so again, we'll get all the nuances of birth control and different life phases in a second, but that's what to expect month to month. So, hitting puberty just really quick. I'm not going to go into this hormone is released which triggers this, but essentially what happens with puberty typically happens between 8 to 13 in biological females. And it's the start of estrogen and progesterone being produced by the body. Again, I'm not going to go through the kind of up the chain start of this, but what tends to happen is that this is when our patients start reporting headaches. Now, children can have headaches. That's definitely very much happens in our patient caseload as well. But for many of our patients that struggle with hormonal based or kind of hormonal influenced migraines, it tends to happen around puberty. And that's because you suddenly have these like cycling hormones, you've got this drop in estrogen all of a sudden. It can also be irregular, and we'll talk about this in menopause, but irregular hormones are a huge trigger for migraines, for headaches when they're kind of fluctuating all over the place. And kind of from puberty on, women are more likely to experience migraine than men. So prior, not so much, but after that, it tends to be a much more female driven problem.
Yeah. So the irregularity and I mean, I've seen a connection with uh, the intensity of the period as well. So heavy bleeding, that sort of thing. So it's like the intensity of it and irregularity both seem to reduce someone's threshold to a greater extent than what would be categorized as like a normal experience for a period or a cycle.
Yeah. Yeah, it definitely can be a problem, and it does tend to stabilize a little bit. It can take a few years, it can take into your 20s. I kinda saw both ways in my research, but, yeah, just that kind of that fluctuation can be sort of hard, and again, that's when most of our women tend to report that their symptoms start is around puberty, yeah, 12 or so, give or take. Next area I wanted to talk about is actually hormonal birth control. And this was what prompted this episode for me because it does come up in conversation. And I was curious about what influence it might have on headaches. So, hormonal birth control does tend to prevent big fluctuations in estrogen, which can be used to prevent hormonal migraine. So, if your doctor looks at you constantly getting migraines from your cycle, they may prescribe you some sort of hormonal birth control. Different types of birth control, and we are not a birth control podcast, so I wasn't going to go too deep into this, but it can be a pill, which tends to either be estrogen and progestin or progestin only, so you can go either way. Patches and rings tend to be estrogen and progestin. And then an implant, an IUD, or a shot is just progestin alone. And the interesting thing, I wondered if there would be a difference between progestin only versus estrogen and progestin. Basically, the interesting thing with birth control is that depending on the person, they can lessen the severity of your menstrual cycle. And we know that that menstrual cycle does trigger headaches. So sometimes, like I said, they can be helpful. Um, Headaches and or sometimes dizziness can also be a side effect though as well. So again, as we're just going to see over and over this episode, anytime you sort of mess with the hormones or anytime the hormones are kind of a little bit say out of whack or if they're cycling and they're going up and down, you can be at a risk for headaches. So the interesting thing about birth control is it can actually go both ways. You can have lessened headache or you can have increased headache.
Yeah, fascinating. There's there's other things like that. I mean, well, medication, I think largely that would be true. It can cause headache. It can reduce your headache. Caffeine's one of those as well. Like staple, a regular-ish consumption at moderate amounts can be helpful, but it can also like cause headaches. And so there's sort of this idea that stability, consistency is a better environment for the brain to be able to tolerate this pain signal. I think that's what's happening.
Yeah. And I've always wondered, obviously, men have hormones too, but I've always wondered if this is one reason you see women kind of struggle so much more than migraine with men is men, to my knowledge, don't have this crazy amount of fluctuation at this level. Obviously, hormones change over time, but um, yeah, this constant fluctuation really does seem to mess, I think, a lot with the headaches. And I will say sometimes estrogen doesn't have any effect too. Sometimes you'll take a birth control and there will be no change in your headache frequency. And we'll talk about that a little bit more with menopause. But yeah, how estrogen really affects everyone a little bit differently, which is very interesting. Moving on. So pregnancy and postpartum, we actually have a full episode. I think I'm like 7 months pregnant during it. um, but we have a full episode on pregnancy and postpartum. So I'm not going to go too deeply into this, but I did think from the hormonal standpoint, it's interesting. So once you do become pregnant, so we're in that phase. If the egg does get fertilized, it does implant, it initiates a pregnancy. Instead of the sharp drop off that's then going to trigger a new period, your body actually starts producing estrogen and progesterone very rapidly. So you're actually going to produce more estrogen during one pregnancy than you're going to produce the rest of your life, which I thought was fascinating. So levels are very, very high of these hormones during your pregnancy, which is good news for most of our patients. So for about 50 to 80% of migraine sufferers, migraines are actually going to reduce during pregnancy, which doesn't feel like what should happen. Anyone that's been pregnant knows that anything that can go wrong usually does go wrong, but migraines are not one of them. So typically, you're going to see just because the hormones are high and they're also fairly stable, um, you're going to kind of see less intense and less frequent migraine. The bad news is sometimes that isn't the case. As I have said over and over, everyone is a little bit different. So sometimes you'll actually start with migraines for the first time during your pregnancy. This is especially during the first trimester, can be due to just the increase in blood volume. Dehydration from vomiting, morning sickness tends to peak in that first trimester. So if you're vomiting a lot, you can just get a lot of headaches. Your hormones are still stabilizing as that pregnancy kind of gets going. It's also stressful, exhausting, and kind of just low blood sugar. There's a lot going on during pregnancy. So sometimes headaches will pop up. And that, again, that can be threshold, that can be just dehydration, a lot of issues. 15 to 20% of women overall are going to get migraines during their pregnancy. And sometimes you will have people that their headaches or migraines worsen or stay the same as well. Definitely something, and I know we talked about this during our pregnancy episode, but if you do have headaches pop up, definitely be in contact with your healthcare provider. Migraines in pregnancy can increase the complications like high blood pressure, preeclampsia, low birth weight, and needing a C-section. So if you are experiencing headache and migraine, that definitely needs to be something you discuss with your OB. But for the majority of people, it's going to be on the better end. I even had a patient I remember one time that her family just kept telling her to get pregnant because she felt so good during her pregnancies.
Yeah. Yeah. Yeah, I think, it's especially challenging for, uh, you know, someone like a woman who's pregnant and is getting migraines because they can't take their medication, right? They don't like doing tests on pregnant moms, and so, uh, because there's, risk involved with taking meds, they usually just say, like, "Okay, no more migraine meds." And so that's where, like, people like us come in handy because we don't prescribe medication. And so having the option of, like, addressing the actual underlying source of pain, is ultimately, there's a lot of people that find us when they're pregnant and they can't take their meds because they're going through life relying on their meds. And unfortunately, they're part of that 10-15% that still gets the migraines. And sometimes it's even worse. The one element of pregnancy I wanted to mention as well, and maybe I missed it, but it's more so, yeah, there's also this component of like physical changes in the body. And so just the stressors on all the different systems can, yeah, most of the time because the hormones are stabilizing, it's good, but then sometimes it's not good and it's actually worse.
Yeah, it puts a lot of stress on your body and it can pull you into, different shifts in your pelvis, different shifts in your spine. And yeah, that very much can have a lot of impact. And that actually dovetails really nice into your kind of segues into postpartum. So postpartum is kind of when, everything comes crashing down. Your estrogen and progesterone levels are going to drop very sharply after your baby is born. So postpartum migraine is actually really, really common. You've had these really stable hormones and then they just plummet. So about 1 out of 4 moms in their first 2 weeks is going to have a migraine, and about 1 out of 2 is going to have one in the first month. So pretty significant. And then you do get all of the, and I think we've talked about this in the past, but being a mom is pretty stressful on your body. So if you're breastfeeding, the breastfeeding itself actually may lead to lessened migraine, but you're still bending forward. You're looking down at the baby. You're kind of even if you're using a pillow, you tend to be in a little bit more of a forward hunch, which can put a lot of stress on your neck. As that child grows, there's a lot of forward. I've got a 1 year old. You're constantly picking up that baby, you're carrying them, you're picking up the car seat, you've got everything all over, cleaning up toys. It never really ends as a mom. And so that can tend to put a lot of stress, that constant forward positioning can tend to put a lot of stress on your neck, which then can trigger. So unfortunately, postpartum headache is pretty common. That's actually just quick personal experience. That's when I started getting headaches. I really didn't have an issue even prior to my time at Novera during my pregnancy. My headaches were pretty much, occasional dehydration type of level. And then once again, you spend all that time going leaning forward, I actually started to have headaches pop up myself. So it's pretty common and it can be kind of disheartening after you've had maybe a little more stable presentation during your pregnancy.
Yeah, being a headache specialist with headaches. Well, at least you knew what to do,
I knew what
right?
to do, and I was able to get them under control pretty fast, but I've thought a lot actually about what I would have done had I not known what to do. It's scary when you've got, a 3-month-old and you're trying to
Right.
take care of that baby and you've suddenly got headaches popping up. I've been actually pretty grateful I knew what to do.
Yeah. Yeah, that's why we try to accommodate to moms with kiddos, and we have kids rooms in each location that we have, and that way moms can bring their kids and get access to care. So, yeah, because it's a big deal. We want moms to keep feeling like they can be moms and show up for their kids because that's work. It's a lot of work.
Yeah. It's I'm
And
always
it's hard
surprised
work.
how much work it is. Yeah, come bring your
Right.
kids and we'll chat about kids the whole time. All
Yeah.
right. Last area I wanted to cover was menopause. So obviously we've been through the life cycle, we've gone through puberty, we've gone through pregnancy, postpartum, et cetera. Probably go through that a few times if you have a few kids. Eventually, though, your body is going to get ready to stop having kids, and so this is a natural process, again known as menopause. And this is when your ovaries gradually stop producing hormones for reproduction. So menopause itself is defined as 12 months straight with no period, and we're getting into the phases in just a second. It's considered normal between the ages of 45 and 55, 52 being the average for most women in the US. And it's got 3 phases. So your first one is perimenopause. This tends to start on average about 8 to 10 years before menopause, and it's just your ovaries gradually producing less estrogen. This is when, and we are not going deep into the symptoms of perimenopause. That's again, you could have a whole podcast about that. But this is when people tend to get all the symptoms that you think of when you think of menopause, headaches being one of them. They may be the worst they've ever been at this point, just due to hormones fluctuating. Again, anytime your hormones are messed up, we talked about this, or sorry, fluctuating is a better way to say than messed up. Um, that tends to trigger the headaches. So, um, couple of things just to think about there. There is hormone therapy. We're not going deep into this issue, but sometimes just to kind of get through the perimenopause phase, they will offer you some hormone or hormone replacement therapy, depending on how old you are when you're going through it. That is something you definitely need to consult with your doctor. It's got risks, it's got controversy. It's not something I am really able to talk about too much just because it's outside of my area of expertise. But Um, that can help sometimes if it's the really severe drops in estrogen and fluctuations in estrogen, you may have some help with some hormone replacement or hormone therapy, but, um, yeah, it tends to be kind of a difficult time. Lasts on average for about 7 years for most people. Um, the nice thing is once you hit menopause, this is actually a moment. Menopause is such a big thing. Menopause is actually a specific moment in time when you have not had a period for 12 months. It's menopause. And then you immediately move into postmenopause, which is kind of life after menopause. The nice thing is about that is estrogen tends to be pretty low, which can come with its own health issues, but headaches don't tend to be one of them. So, kind of for the many people, once hormones finally drop, they stay stable. A lot of our headache and migraine sufferers, actually, their problems sort of end at this point, which is very interesting. And it's not necessarily what we want. You hate to tell someone they've got to wait to live their life until they hit 55. But that does actually tend to be one benefit is the perimenopause tends to be very difficult for the headaches. You hit menopause and then it um, tends to be kind of sort of scot free after that. So I think that's kind of cool.
Yeah. There's different factors at play, meaning the people that have the scenario where hormones and the fluctuation of hormones are driving that threshold down to a significant level that, maybe the neck issue isn't significant and okay, so we've stabilized hormones, then it's clear sailing. I would say for others, it's going to be, because we're looking at hormones as manipulating threshold and the underlying source of pain still being there. And so, because we still see quite a few women past the age of 55, and I think they'll go through a rough patch when they're in the perimenopause, and into postmenopause. And then some of them, they hope for that moment, but when it's not there, that's kind of who I'm speaking to. I'm trying to encourage that person. There's that underlying mechanical source of pain that really needs to be addressed. And I also want to talk to the women that are like in the middle of this and thinking like, "Oh, if I just make it a couple more years, it'll go away." And I would say, I still wouldn't wait for that moment just because there's a lot of objective mechanical things that actually need to be corrected. Like your pain that you're experiencing is the body signaling to your brain of there's a problem. So we need to understand the problem. And so the fluctuation in hormones is just allowing your body to be more sensitive to it or not. So every woman, every female is going to go through the same process. The intensity of it will look different, but the fact that some have migraines, some have headaches, and some don't has to do with like what the underlying source of pain is, and that's kind of what I'm saying. Is like we would want to address that, and that's specifically for those women that I'm trying to give them hope when they didn't find the relief they were looking for.
Oh, yeah, and I do want to make sure I wanna second that, that there's always hope. It doesn't really matter where you are in this process. That underlying cause is still the same, and it's the thing we see over and over, that upper neck tension. That can be treated at any point in this process. You don't have to go through puberty. You don't have to wait and see if pregnancy, kinda solves your headaches temporarily. You don't have to go through the postpartum. You don't have to wait to see if they stop after menopause. This is a treatable issue at any stage of this process, and yeah, I think that's a good reminder of just because those hormones are fluctuating doesn't mean you have to have headaches. The only thing I just wanted to end on then, so big takeaway for this is that if you are someone that you feel like your cycle impacts your migraines, you're probably right. Most people, if there's fluctuations in estrogen, be they from puberty, from pregnancy, um, from postpartum, from birth control, from menopause, fluctuations in estrogen can cause changes in headache and migraine and other symptoms. So if you are feeling frustrated and powerless and just, well, I can't control my hormones, I just wanted to leave off on a couple of things you can do. So, one of the biggest things I really educate my patients to be aware of is if you do know that there's going to be a time you are more likely to get a headache, and this can be the days around your period, this can be big storm coming in, just anything that you know is going to be a trigger, you want to work to control what you can control. So, maybe the 2 days before your period is not the time to eat 3 pieces of cake. I'm not sure when the time to eat 3 pieces of cake is, but it's probably not 2 days before your period. Likewise, if you know, for example, alcohol is a big trigger, probably not the time to be drinking. You want to probably track your cycle as well. We've recommended, I believe we've got an older podcast episode about headache journaling. This can be very helpful as well, just kind of keeping an eye on your cycle and kind of knowing, okay, I need to take care of myself during this 5 or so day period around my period, just to make sure I'm giving myself the best shot for not having a headache. You can talk to your doctor about different hormone therapy, medication, birth control, etc. That's, like I said, not really our area of expertise, but that can be something that's a good conversation to have with a doctor or an OB, which is the type of doctor. The last thing is just there are some dietary kind of phytoestrogens, is what they called, some natural sources. So grains, beans, fruits, vegetables, chickpeas, lentils, and flaxseed can be sort of a natural source of estrogen as well. So that can be something, good things to be including in your diet anyway for most people. Um, but that can be kind of a natural source. So, yeah, I just want to second Dr. Taves and just give people a sense of hope. Like I said, this is something that impacts a lot of people. It's very, very common in our patient population, but it doesn't have to define you, and it doesn't have to just be something you grit your teeth for those 5 days. There's definitely treatment out there for this.
Yeah. Well, that's great. And I appreciate you, yeah, diving into this. And I know there's uh, several sections of what we talked about that we could go deeper, but I think this is a really good overview for people to and that's the whole point of this podcast is to educate so that you can feel empowered, to make change in your life. So thanks so much, Dr. Thomas.
Of course, it was fun.
All right. So if you're listening to this and you appreciate what you're doing, I want you to leave us a 5-star review so that that'll push the algorithm to be in front of more people and we can continue on our mission. But as always, it is our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. And we will see you next week.